Governor Boyd Rutherford.
Thank you. Thank you very much. Thank you and good afternoon. It is truly a privilege to be here today with you. Bob, thank you very much for that introduction. And I want to, point out that I'm joined here today by Secretary Bobby Neal from the Department of Health. I was getting ready to call it by its old name, Health and Human Services, I think it was, or something like that. Mental hygiene, right, DHMH. Steve Hsu is our Executive Director of the Maryland Opioid Operational Command Center. There are other secretaries here that are not in my talking points, but all the other secretaries who are here and executive agency officers, and of course, all the others who are here and those with Helping Up Mission, and particularly the choir, thank you very much for that inspirational song. You know, Helping Up, and I hadn't called it HUM before until now, is a fantastic organization and is doing great things in the community here in Baltimore as well as in the state of Maryland. And our administration is very proud of all the support that we've been able to provide, and particularly through Department of Housing and Community Development's Community Legacy Program, and Secretary Holt is here with us. As most folks here know, fighting the ever-changing heroin and opioid epidemic here in Maryland has been a major priority for Governor Hogan and myself over the last 4 years. We've had a laser focus on implementing holistic, multi-pronged approach to combating this epidemic through prevention, treatment, recovery, as well as enforcement efforts. And as you know, the epidemic transcends every demographic. It doesn't matter, who you are, where you're from, what your educational situation is, or economic situation, or the community you come from. Addiction does not discriminate. With that in mind, one of Governor Hogan's first acts as governor was to create the Maryland Heroin and Opioid Emergency Task Force, which he asked me to lead. That task force, we conducted regional summits around the state, and we came up with 30 recommendations that we've been working on implementing over the last couple of years. And those recommendations included enhancing treatment programs, expanding treatment programs, enhancing quality of care, boosting overdose prevention efforts, more education and starting education in school earlier than waiting until high school. And I used to say, and I still say it, you can start early because virtually every third grader can tell you how unhealthful cigarettes are for you, but many of them can't tell you how dangerous it is to take someone else's medications. So you can start much earlier than what we had been doing in the past, as well as providing other support services and better coordination amongst our state agencies. Since then, our agencies have been working very hard, as I said, to implement those recommendations. And in addition to that, we became one of the first states in the nation to declare a real state of emergency to address this issue so that we could better coordinate with our local as well as federal partners to address this epidemic. In 2017, the governor signed an executive order creating the Opioid Operational Command Center to build upon community-based efforts and approaches to addressing this crisis and increase our collaboration with our local health departments, education services, as well as emergency management entities. But while we've made some progress in some fronts, like reducing the number of overdose fatalities from prescription opioids and from heroin, the crisis continues. Deaths from synthetic opioids, such as fentanyl, continue to rise. Approximately 80% of our opioid-related overdoses are related to or directly related to fentanyl. And we're starting to see fentanyl being included in other drugs such as cocaine as well. So as this crisis evolves, so must our response. Governor Hogan and I will not stop in our efforts to combat this epidemic and save lives of our fellow Marylanders. To date, our administration has invested hundreds of millions of dollars to address this particular issue. Today, I'm pleased to announce a number of funding initiatives to expand treatment and prevention efforts across the state. And this includes $248 million in the governor's allowance in the general fund for substance use disorder services, a 20% increase over our FY19 levels. $172 million is dedicated funding to existing non-Medicaid substance abuse disorder and addiction programs. $66 million over 2 years in new federal grants to initiate and expand opioid prevention and treatment services. And a third installment in the $10 million fund that activates our opioid operational command center, which is now housed in our Maryland Emergency Management Agency and keeps with the governor's 5-year commitment of $50 million. $3 million is being used to establish new and expand existing behavioral health crisis response programs and services in our local jurisdictions, in addition to funding 4 new residential crisis beds in Somerset County. And $378 million over 5 years for the design and construction of a secure therapeutic treatment center in Baltimore City, a specialized facility that will provide mental health and substance use treatment services and care for nonviolent offenders upon their entry into the criminal justice system, and with a particular goal of reducing recidivism. And Steve Moyer from our Department of Corrections and Public Safety is here. Public Safety and Corrections is here today, and I want to point him out. Our capital budget funding is for local treatment and community organizations. And one of them in particular, we're committing $1 million to an organization that you may have heard of called the Helping Up Mission for their women's and children's facility that's planned for right down the street. In addition to that, $500 million for the Frederick County Detox Treatment Facility and $750,000 for the Harford County Crisis Center, to name just a few of those programs. Additionally, while we've invested heavily in expanded treatment options, we know that once someone leaves residential treatment, their ability to access and maintain a supportive and stable housing situation is a key factor in their ability to stay active and engaged in recovery. Therefore, we are increasing the budgets to 2 existing programs: the Community Mental Health Addiction and Development Facilities Grant Program, which is way too long, Mr. Secretary, in the Department of Health, and the other being the Shelter and Transitional Housing Facility Grant Program with the Maryland Department of Housing and Community Development by $1 million, which would allow us to increase the number of recovery residents across the state. As we expand these resources and services, we must also ensure that our recovery residents provide quality services that are free of fraud and abuse. And that's why I'm asking our Opioid Operational Command Center, along with the Department of Health, to study how we can safely and effectively expand access to recovery residents and report back to me by July 1st of this year. Now, adding all these investments together, that's over $800 million, including $500 million in new funding over fiscal year 2019, which is targeting opioid use and substance use disorder prevention and treatment efforts. And I want you to note that that does not include the funding for Medicaid, our Medicaid spending as well. And that is quite an investment. And it goes to show how serious our administration continues to take with regard to this crisis. Now, in addition to the funding just announced, I am especially pleased to announce a new executive order signed by the governor that establishes a commission to study mental and behavioral health in Maryland. The governor has tasked me with leading this commission as the chairman. The commission will consist of key cabinet members and voices from those who are directly impacted. We will engage families, advocates, practitioners, and all those on the front lines of this issue. We will conduct regional meetings across the state to hear from communities, and that feedback will create recommendations that we will submit to the governor by the end of the year. Now, this commission is significant in today's announcement because any addiction expert and non-expert can tell you that the likelihood of an individual with mental health issues or substance use disorder tend to have a higher propensity to having both of those conditions, or co-occurring conditions as it's often called. And just as there is a stigma attached to substance use disorder but there's if not a larger stigma associated with mental health and behavioral health challenges. So it's time that we have a serious exploration of our mental health delivery system. In many cases, people will seek to self-medicate for mental health issues that they may be unable to address or which have not been diagnosed. Additionally, individuals with an undiagnosed mental health or substance use disorder are more likely to experience homelessness, joblessness, negative interactions with the judicial system, become violent, or victims of crime or suicide. And these issues do not just affect that person who is suffering, but it also affects their families, their friends, and their communities. It is extremely difficult for a family to get assistance for an adult family member. And that includes children who have been diagnosed with conditions and they have received treatment through their youth for several years, and then all of a sudden on their 18th birthday, they're considered competent to make their own decisions. We need to address many of these issues. And it's even more difficult to get assistance when those issues arise later in life. We all remember the instance of the woman who was released from the local hospital not too far from here in West Baltimore in her hospital gown on that dangerously cold night. It was clear that she could not care for herself, and she should have been placed in an area or in a facility that could help her instead of being turned out on the street. So we must take a look at this system, the system that we have in addressing this issue. A fresh and serious look at the way the state, and the country for that matter, brings care to individuals and their families. Now, none of this is going to be easy, but it reminds me of what President Kennedy once said when he talked about going to the moon, and I'm paraphrasing. He said, "We choose to do this and other things, not because it's easy, but because it's hard." He went on to say, "Because that challenge is one that we are willing to accept and one that we are unwilling to postpone. We must do this now." So in closing, we will continue to fight against the opioid epidemic. We will work to address the mental health issues in our community and the gaps in our system. And separately, but they are related, our commission will bring additional attention and a sharpened focus to improving the services for Marylanders affected by mental health, illness, as well as co-occurring disorders. At this time, I'd like to turn the podium over to Secretary Neal and Executive Director Hsu, and then after their discussion, I'll be willing to answer questions from the media. Thank you.